I had no idea what are the vessels here. इसको rotate किया, वो सीधा इधर cover हो जाता, the patient would go for radiation early, and we were happy. Then I started showing it in workshops. A Sikon workshop happened in Banaras. I showed in a male breast cancer, removed the whole skin, we just mobilized it, and people felt it very quick. So we had 50 cases that we presented. We called it anatomy में देखा कौन से flaps. We started looking for these vessels. Then we called it LICA, lateral intercostal artery. We हमें पता नहीं था ये बाद में LICAP के नाम से थोड़ा fancy flap हो जाएगा. So when they talked about LICAP later on, so I thought कुछ नया आया होगा. This you were using for ages, but we didn't know the vessel. So every flap is a random flap till you find it is taken. It becomes an axial flap once it takes up. Naturally, it has some vessel. You don't know about it. That doesn't mean the God doesn't exist. अगर आपको नहीं मिला तो. So if somebody does well in spite of the world, you say God exists somewhere. You say, ये कैसे बच गया? Same thing applies here. All those random flaps have become axial flaps now because we have understood anatomy better. LICAP is nothing. Lateral intercostal artery perforator flaps. All are perforator flaps today. We don't take big flaps involving muscles anymore. LD is a poor option. Volume is less, plus some young patients may have to do rope climbing, rowing. In the UK and US, people don't like to put a LD at all because patients refuse. That is how perforator flaps came into being. So that's a nutshell. What you already know, I've told you in a different manner.